Welcome back to Empowerment Nursing. I'm Linda, and this is Ashley, and you joined us for our series In the Know, where we make it simple. Today we are simplifying the subject matter, therapeutic communication.
This is a term that causes a lot of stress to many nursing graduates and nursing students as well, because therapeutic communication is often seen as that gray area, right, where you have to come up with a judgment and you think there's two correct answers and they both sound right, and what should the nurse say? There is never two correct answers. There is always only one correct answer, not a question that's more correct than the other, one correct answer based on a series of principles, which we're going to talk about today. Therapeutic communication is the basis of the effective nurse-client relationship. It is heavily tested on all registration exams across North America. You will come into situations in a question and scenarios where you have to know what is the right thing for the nurse to say based on principles, and we hope we can help simplify this for you today so there will be less of a question in your mind in terms of what that right answer is. So we have a side-by-side that we're going to simplify for you. We have here on the one side therapeutic nurse responses as opposed to non-therapeutic nurse responses. So Linda will be our therapeutic response, and I will give you kind of the flip side as to the non-therapeutic nurse response.
So we start here under therapeutic with open-ended questions. This is a question that leads the patient to tell a story. It's not a yes or no answer, such as, can you tell me what brought you here today?
The opposite to that, of course, would be closed-ended questions. A closed-ended question would be something that results in the patient saying yes or no, such as, are you here today to see the doctor? Yes or no. I'm not inviting any story. I'm not asking for any elaboration. I'm not starting any conversation with a closed-ended question.
The next is listening. Being quiet allows the patient to keep speaking. One of the greatest techniques are the listening skills of the nurse. I know it can be uncomfortable to not be filling the space with conversation, but if you can learn to be okay with your own silence, it invites the patient to speak. So using empathetic gestures such as nodding your head, looking in their eyes, saying sounds such as, aha, right, okay.
The opposite of that, of course, is talking. So as opposed to nodding and allowing the patient to continue on with the story that they're telling, you're interjecting and you're talking, you're taking over the conversation, or you're constantly responding to everything that they say to persuade them, I guess, in terms of how the conversation is steered.
Next, we have clarifying, and this ensures that the nurse is accurately understanding the patient. So saying something like, I'm not sure I understand what you're saying when you tell me you're sicker than usual. What is different now?
This is very different from assuming. Assuming is, so the patient says they're sicker than usual. I can assume then they think they have the flu, and I'm going to document on my assessment, patient is complaining of the flu, as opposed to clarifying what they mean by saying that they are sicker than usual. So I'm making judgments, assessments, documenting, all based on assumptions that come from my own personal experience, be that in my personal life or with other patients.
The next is summarizing, and summarizing is really a concise review of the nurse's assessment of the patient. So a sentence such as, based on what you're telling me, you're concerned about the following issues for the following reasons, and you would outline them, and as a result, we're going to take these next steps.
It's worth mentioning here that summarizing is quite often the correct answer in terms of a multiple choice. What would the nurse's best response be? Summarizing, I find, is quite frequently the right answer to the question if there's a summarizing option. This is the opposite of changing the subject. So as opposed to summarizing what you just went through with the patient stopped speaking, and you immediately change the subject to, okay, that concludes my assessment, and the physician will be coming in briefly to speak with you.
Next, we have neutral. It's not the nurse's place to take sides on a patient's decision. We educate. We don't opinionate. And as an example would be when a patient has multiple treatment options, we don't tell them which one they should choose. Instead, you would say something like, this is a difficult decision. I'm here to support you.
This is very different from offering an opinion. You would never offer a personal opinion to your patient in terms of, so here's your treatment options. My opinion, though, is that you should take option A for this reasons, whether that be based on your personal or professional experience. That is your opinion, and you do not offer your opinion to your patient.
Next, we have educating. We educate on the various treatment options. We lay them each out for the patient to choose.
This is very different from advising. Advising is not educating. Advising is, you should do this. We never offer advice to our patients. We offer education to our patients.
Next, we have empathy. An empathetic statement would sound like this. Thank you for telling me what you're experiencing. It must be so hard. I'm right here.
This is very different from judgmental, in which something bad happens, say for example, and the nurse's response is to say, at least this didn't happen, or think of it this way, it could be worse. This, and this could have happened.
Next, we have non-assuring. Non-assuring relates to not saying it's going to be okay to your patient, right? Instead, saying something like, we're going to do everything we can to help you. You must be so scared. We want to appropriately encourage our patients.
This is very different from the non-therapeutic response of offering false reassurance. So you will never say to a patient, nor will it ever be the correct answer in a multiple choice question, as an example, for you to say, don't worry, it will be okay. Right? You will live. Everything's going to be fine. That is false reassurance. We can never, ever provide that to a patient.
Then we have patient focused. The conversation should center around the patient. We all have our own personal experiences to share, but not with a patient. This is not part of the therapeutic relationship because it's not a friendship.
This is the opposite of nurse-focused, which is non-therapeutic, meaning the patient shares some information with you and you say, oh, I know exactly how you feel. Somebody in my family was also diagnosed with that, and this is what happened, and this is where we went for treatment, and we did this, and it immediately takes the conversation away from the patient and the patient's focus and makes that conversation focused upon the nurse, which is not what we want to have happen in a therapeutic relationship.
And finally, you can see at the bottom, we have never ask why.
So we do this fun thing in our live reviews in demonstrating the why, because it often sounds convincing in terms of one of those options as the right answer, because they make it sound very therapeutic. And I like to say that's because you read it in the Linda McDougall tone of voice. As an example,
why do you feel this way?
And that's not how the registration exam interprets it. The registration exam interprets it as, why do you feel that way? Right? So with that connotation and that tone of voice, the nurse never says why. You can basically cross that off of one of the options immediately because it is never going to be the right answer to ask them why. It infers judgment, and it is with a negative tone of voice.
So we hope that this has helped you simplify the principles of therapeutic communication, where there is one correct answer.
One correct answer. And for this and all other concepts simplified, you can visit our complete study package. So if you know somebody else who's struggling with therapeutic communication, if you have nurse friends, belong to a nurse group, share this video and feel free to tag a friend and subscribe to our Facebook page. We'll see you next time on In the Know.
Bye for now.